I recently did a video which was an overview of tear trough augmentation, which is putting filler underneath the eyes. This is a great procedure that's quick and easy that yields amazing results with just a little bit of product, very little downtime, and it's very understated, so your neighbors aren't really going to notice what you're doing. That being said, there are sometimes some bad results. This area requires advanced injection technique, knowledge of anatomy, and experience with filler under the eye. I received an email 2 days before Christmas from a patient who had been injected in November by a doctor with Bellatero under the eyes. She had gone back to this doctor and showed him the end result, which was a puffiness or a bag that was way worse than what she had originally gone in with. She was told she had an allergic reaction and that there was nothing that they could do. Of course, this woman, being very smart, went and got a second opinion. The second doctor told her she couldn't help her because she didn't do the original injections, but did kindly give her some arnica to help with her bruising. It is hard to know how much product and where fillers have gone when you didn't inject them. Liability-wise, it is a tricky situation. The following picture is a picture I took upon first meeting this woman in my office. As you can see, she has a distinguished bulge under her eye, which, as she explained, she did not have prior to injections. The picture to the right is 10 minutes after I injected a product called B-Trace, or hyaluronidase. B-Trace is an enzyme that breaks up hyaluronic acid-based fillers, which are Juvederm, Restylane, and Bellatero. The product is difficult to use because it is not very precise. It does work immediately, but the results take about 24 to 48 hours to settle. After injecting, the skin can look shriveled, but it will return to normal within about 48 hours. The patient still had bruising from 2 months before from the original injections, so prior to injecting her, we did discuss that she probably would be bruised for Christmas. Having some experience with V-Trace, I felt comfortable enough with this patient to try to dissolve it for her. This picture was sent by the patient to me via email the next day. As you can see, her right eye still has a little bit of product underneath it, but it looks much better. And her left eye, of course, has quite the shiner. I was able to salvage some of the original Bellatero. This picture is in the office a few days later. The patient was very happy that the product had been dissolved and that she no longer looked like a bullfrog. Even with all this patient had gone through, she still was up for trying Bellatero again. This is a before on the left where the product had been dissolved, and an after I had injected a little bit more Bellatero just to even her out. Her end result is amazing because Bellatero is an amazing product. This turned out to be a great before and after. On the left is the picture that was originally emailed to me from the patient's house, and on the right is after our final treatment with the Bellatero. If you have a bad experience with a tear trough procedure, it can be fixed. Do your research and find a qualified tear trough experienced injector. I would venture to say that tear trough augmentation is one of the hardest treatments to perform with fillers. There's a very fine line between undertreating and overtreating, and many people overtreat. However, when you have it done correctly, it takes years off your face and looks amazing. I would like to thank this client for sharing her pictures and her story with us.